start with Miss Popularity, Kate.
Nice to see you again, Kate and me.
I have to say, I'm pals with Kate's dad, so I have a special affinity, but she's as good as policy-wise and everything else.
Yeah, and for everybody else, I'm Molly Bogart. I'm Director of Government Relations at DHHS.
Meg Reed Heigen, Director of the Office of the Health Insurance Marketplace within DHHS.
Jean Lambrew, Commissioner of Health and Human Services.
Yeah, why don't we go over to the,
Linda Sanborn, retired state legislator and physician.
Sana Osman, community health worker, a nonprofit in Portland, called me.
Julia Underwood, Associate Director of CAHC.
And I'm Valerie McCausland, Office and Systems and everything else Manager.
and Valerie, you're the
Camera
longest-serving
person.
Kate employee.
I am, 17 years.
Oh, wow.
18 in
Congratulations.
March, yeah. Thank you.
Right. And I'm a guest, I'm Juliana LaRue, and I'm the president of the American Nurses Association of Maine, and I've been involved in a lot of healthcare initiatives around the state for a couple of years.
I am Ann Lang. I'm a board member and work at Amistad in Portland.
And Lee Umphrey, president of EMDC. I previously ran the Harrington Health Center, and this is the only remnants of healthcare that I continued because I thought it was important, advocating for consumers. And the funny part, first time hearing your name was people from Washington say, "I must know you." And I'm like, who the hell is that? And then, with the Obama's book comes out and you're all in it. But so I had so many people say, call it. I'm just running a FQHC, so I never called you. But New York Times came to do a story on why this small health center was signing up so many people in Obamacare and all this stuff. And she said, "You must know." I said, "Oh, yes."
Because if you're not in Maine, everybody thinks
Well,
you
of
know
course.
everybody in Maine.
Yeah.
All those other people think you know everybody.
And I even made a reference to South Portland being so far away and all this stuff. But it really kind of gives you an idea on the work that the Commissioner had done previous to here, and the importance with Governor Mills winning 4 years ago and what she wanted to do. And part of the big part of her campaign was to rebuild state government and to reinstate not only confidence, but the way we run programs. And DHS was a huge problem, and it needed to be reinvented pretty much. And it's no mistake that on Governor Mills' first day, she did the Medicaid expansion and then brought you in. And for us, and the pandemic hit, but there's a lot of work done before the pandemic, reinstating public nurses and creating systems internally and reinforcing the idea on what the goals are of the department and getting staff morale up, getting the good guys to stay and the bad guys to leave. And there's a lot of heavy lifting that happened. And then the pandemic hit, and even though Dr. Shaw is the most popular guy, I think everyone knows it's a team effort, and it's really remarkable. And for us as an organization, having that partnership that wasn't as strong with the previous administration is really important. And like you've said, we can do some of the things hands-on and listening and helping and guiding that you folks are swamped with. And so we're really an extension of who you are. And it's a true partnership, and so we value it. And if the governor wants to put us in the budget, we'll accept it.
Pay for fair time.
You can tell her that because she missed the meeting that was
There you go.
decided. But it's really a true partnership, and having had a career working with different agencies, DHS has always been the hardest one because of how big it is and how hard it is. But I think you've brought a credibility, not only with content, but just to be responsive. And I think it really comes through. It comes through at the State House and around the state. So a big part of that is your leadership and the team you've assembled. I told your colleagues how disappointed I was that Sarah Gagny Holmes wasn't here. So she's a workhorse. You guys are the show horses.
The fact that there are 3 of us here at once is like shocking.
But
Somebody had to man the office.
Exactly.
But it just, you don't get credit too much, and government doesn't get credit too much, but through the pandemic and through everyday services, you know, we're dealing with folks all the time who need certainty and need information, and we provide it, but we can only do it with your support. So I just want to, on behalf of everybody, thank you for what you do.
Well, I am here to thank you, actually, because this idea of true partnership is without a doubt true. I will just say that, you know, it begins with people, right? It really does begin with people. Like the first thing we did was to assemble a team, you know, Meg, Molly, Sarah, people who had two different things going for them. Skill, savvy, experience, ability to do the job, and heart. They had to be committed to the job because these are not easy jobs, and you know, when the going gets tough, you need to make sure people are there for the right reasons, not for the glory, not certainly for the money in state government, but just for the right reasons. So that was a big part of it. But I would just say, going back to kind of what we've done, I mean, you all should feel pride. You know, just doing the quick rack up. Day one, Medicaid expansion. That was day one for Governor Mills, but not day one for all of you. This is something you all have been working on for years and years and years. And so we were able to walk in on the pathway that you forged through good, hard work to say, this matters. This is not about politics. This is about public health. This is about access to health care, and this is why we need it. So that's why we were able to walk in and do that. We also were able to stand up a state-based marketplace. We were able to reduce small business insurance premiums for the first time in over 20 years. We were able to lead the nation in lowering the uninsured rate in Maine. We, not us, we as a team, because we would absolutely not have been able to do it without you. But it wasn't just about getting people that card. It was making sure that card worked for them. That meant ensuring that we have a dental benefit. My goodness, that's a long time coming, and it matters so much to people. A lot of work to do still on that, but that's something that matters. Behavioral health, we know we have had serious challenges pre-pandemic. They only got worse. And we are right now still trying to make sure that we've done a good job making sure that when people have coverage, they have access to behavioral health and related services. And we also know that having those basic insurance protections. I mean, I remember trying to fight to get, the ban on pre-existing condition, prohibitions and rate ups and all that. And that was rough. It was hard to do. But here we are, first couple months of Maine, codifying that. So those protections could never be taken away. As well as just the ongoing work to try to make sure that what we do to support our providers is sustainable. And it's not the kind of glamorous part of the job to make sure that Maine Care is a fair and good payer. It's actually a very hard job to do that, but it matters because we know too many people who can't find the primary care doctor or the dentist, even though they're entitled to those benefits. So that is work that continues for us, as well as I'm so glad to hear we have a community health worker here. We need to go beyond the four walls of medicine to really make sure that our people in our communities are healthy, and we are absolutely committed to growing our community health worker teams, our community-based organizations, which again, you talk about the silver linings of the pandemic. Boy, we struck out in the early parts of the pandemic with racial disparities in COVID-19 that were shameful, just shameful. But in trying again and finally listening and finally learning, we really stood up a team that, according to, these data are not even published, but Maine did the best in the nation on preventing disparities in vaccination. We missed on the original part of COVID-19, but we excelled when we got there, not because of us. It was because of the groups out there who are on the front lines who we basically broke down some of those institutional barriers that had made it hard for small community-based organizations to get state funding. And they're there now, and we're now trying to figure out how do we transition them? How do we make this a true part of our healthcare system, not just our medical care system for ongoing, needs. And FQHCs, again, you talk about partnerships, couldn't have survived the pandemic without them. They always, whenever we needed particular help, we have particular problems, we pick up the phone, call, and they were there. They were always willing to figure out how we meet people's needs, and I think our job now is how do we identify what worked best, continue it, but then figure out what are the remaining gaps, because we know we have challenges. And as I said, that's part of the reason why I can't stay for lunch, is I've got to go back and figure out what our budget is and our bills are and just fight for the things that we need to really fulfill some of the promises. But let me just say something about CAHC. you are a true north for what we need to be doing. It's a sounding board. It's like, where should we be going? We can't always go there. We try to get there. We stumble, we fall. We sometimes have competing priorities, but having that plus good solid ideas. You know, we're all sometimes too busy to kind of figure out what is that next thing? What is that next increment of policy that would really make a difference? Where is the legislature? What are the opportunities? And having that there, again, we may not always be able to meet it all, but having that there is invaluable. And the criticism. You know, we welcome the criticism. We need the criticism. We can't always see what we're not doing right and how to get back on a path towards trying to do the best job for the people of Maine who we serve. So we totally appreciate that. And I just can't say enough about the fact that you all do it with civility, with intelligence, and with grace, which I can't say for every advocacy organization in Maine. So thank you. I came here to thank you all. Thank your board for supporting the team. Thank the team who's back hard at work trying to get people signed up for coverage.
Yeah, they would be here normally, but when the day.
They're working.
So I'm sorry that we made you do more work in preparing. to come here.
This is a joy. This is like a tiny bit of investment in all the kind of benefit that we get from this organization. So please.
And our goal is to get you out more.
So we really want to take a picture, but we put this together for you and the governor, and I know we're missing a lot, but it basically, for each year that you've been here, lists some of the things that you have accomplished. And we are always badgering you to do more, but we are also cognizant of the fact of how much you've done. So hopefully this is something that you can put on a wall of shame, even if it's in the bathroom.
Wall of pride.
But yeah, we have one for the governor too, so we can either drop that off or maybe, I don't know if there's somebody that can take it, but, so that's for you as a thank you.
Thank you so much.
No, I haven't been in.
So the commissioner is known for her,
This is what I
like,
do.
yeah,
This
just
is
like
so much
flipping
freer
the
than
thing.
I have recently been saying I've got to take all that other stuff off the wall and find the room and couldn't find the time to do one for me.
I think this can go alongside the
Yeah,
ACA
yeah.
memorabilia.
Very
Trust me, I'm getting it's gonna be 50-50.
And we know we're missing a lot, but.
Expansion, but I know
Doesn't
not
matter.
everything is
You know,
done. We just wanted to, again, thank you for
Signed fonts.
the amazing amount of work that you all have done.
You got a bunch of good things in here.
Yeah. Anyway.
Every single one of them makes you just like feel like it's worth it. And I will just say one final thing because I can't stop talking. So yesterday at the event we had with the governor, a woman named Pam came up from Gorham to talk about her experience. And you know, it number one reminds us why health insurance matters. It's why we do this. It literally saves lives, but it also is a reminder of why Kate matters because it was a complicated set of circumstances. She needed specialized help. You have the patience, the time, and the knowledge to help people in ways that we struggle with. When we have a high volume call center, we struggle with when we have 3,400 people working at the Department of Health and Human Services. So you should just know that so many of the people that are helped on this were helped because of you. So thank you. Oh.
Let's take a group picture.
Can we try to get a picture?
Yes.
Sure.
Wow, that's great.
The team has to come up with me too.
Yes, that's part of the team.
Everybody who's here should.
All right.
Everybody has-
I